Did you know that 1 in 4 people in the UK fit the criteria for metabolic syndrome? Now, you may not know what metabolic syndrome is. Basically, it's your waist expanding, your blood pressure rising, your blood sugar rising, and your cholesterol rising. It's all 4 of those things together. So if any of you have just one of those things, you're en route. And women over 40 are at much greater risk. Perimenopausal women, the risk increases again. And chronic stress doubles the risk. So we're now talking probably about at least 1 in 2 women here. Women in this room, 1 in 2 women in this room who are going to go down that road or some version of that road. And I know I'm shouting because I want you to hear, because I don't think enough people know this. Why does this happen? Because before we go into menopause, most of our stress is managed by those reproductive hormones, those ovarian hormones. Once we start losing those ovarian hormones, all our stress is managed by adrenaline. Up until then, it's only come from our reserve tank. Now it's the only thing we have. And that's one of the reasons why those symptoms that Joe talks about, the anxiety, the gut health, those issues that hit the shoulders pain, there are so many. That's one of the reasons why listening to this anxiety and going, now what do I do, is super, super important. So we go from those reproductive hormones into the adrenaline hormones. And once we get into adrenaline, we're producing cortisol on a regular basis. Now, everyone talks about cortisol these days. A lot of people don't really understand what it does. What it does is bring sugar out of storage. So remember those 4 criteria I just talked about? Sugar is a main driver for all 4 of those. So cortisol is bringing sugar out of storage. It's making us produce insulin to bring the sugar down again. And when cortisol and insulin are working as a team, they stop all those other things from working properly.